Hi, welcome back. I'm Dr. Rachel Blumenthal. I'd like to give you a little bit of information about constipation in children. Constipation in children is extremely prevalent. About 30% of children will experience constipation at some point in their life, and it probably takes about 3 to 5% of our office visits to discuss these issues. Most importantly, what is constipation? Constipation, it could be defined by a multitude of factors. It could be defined by frequency or infrequency of stool, by the size of the stool, by the hardness of the stool. It could also be defined by the amount of straining and pushing needed in order to have a stool. Constipation would be defined by different parameters. It would not look the same for an infant as it would for an older child, nor for the ages in between. I do want to give some level of reassurance. About 95% of constipation is because of a functional reason and not because of an organic pathology. Probably only 5% of constipation is because of a medical reason, and 95% of the time it's because of a functional reason that we can help address simply in the pediatric office. A history taking with mom and dad and that child will be key. How long has this been going on? Is this new, or has this been going on for a very long time? How frequently is the child having stool? What does it look like? Does it have a certain color? Does it have a certain shape? Does it have a certain size? The ideal stool shape for a newborn is also different than an older child as well. In newborns, we're expecting no firmer than peanut butter paste, but usually it's much looser than that. In an older child, we're actually expecting a stool, if it's ideal, to be very smooth in texture, either like a little lump, almost like soft serve ice cream, or like a very smooth snake. If a child is having stool that comes out with little pellets, little balls, or is lumped up, that's already a sign of constipation, because that is too hard to be having on a daily basis. If a child is having functional constipation, it means it is related to behaviors around potty training, their diet, their fiber, their water intake, as well as stress in their environment or other medical conditions that could be going on that might be making them have a firm stool that they may not be able to pass easily. Your pediatrician would go into detail about these details to make sure we're giving you the correct diagnosis and treating your child accordingly. If the child is having functional constipation, many times we address it first through diet modification, high fiber foods, less processed foods, having more water in their diet. Sometimes children do need to have help with medication so that their child can have softer stool as well. There are many stool softening and constipation relieving medications available, but not all of them are the same. There are some very big differences to them, and we would want to make sure we're using the right medication for the right child. And whenever possible, taking that medication away once that child is doing bowel movements well for themselves.